Okay, it's 11:32, and I'm just going to say, first of all, my name is Gil Preuss. I'm the CEO of the Jewish Federation of Greater Washington. Thank you, everyone, for joining us for this important conversation today. Like all of you, we're obviously monitoring and responding to the COVID-19 outbreak. One of our commitments as a federation to the community is to connect community leaders to be able to learn and talk with each other, ask questions and get advice as we're all seeking to navigate a situation that for most of us we've never had to deal with before. So this will be a first webinar. There may be others in the future on similar or different issues. I'd like to first in the offices here. Joining us from their offices at Suburban Hospital are Dr. Eric Dobkin, Suburban's Vice President of Medical Affairs, and Dr. Sonia Qasba, their Medical Director of Antimicrobial Stewardship and Lead Infectious Disease Physician. These are three leaders in the medical field, and they will share their unique perspectives on the rapidly changing situation, including both some background and context, as well as the rapidly evolving local and global situation, as well as some ideas for a local response. We are very grateful to have each of you here today, particularly during such busy times, and we appreciate you doing this with us. We're going to start off by asking each of the three guests to share some thoughts. After that, we will take questions via the chat box. So everyone is already clearly proficient with using the chat box based on what I see. And so we will get to that as we go forward. So first of all, I'd like to turn to Dr. Dobkin in terms of some of the history of the coronavirus and what are the things that we need to know in terms of how it's evolved to this point today. Dr. Dobkin.
Sure. Thank you so much, Gil, for inviting me to speak with your audience this afternoon or this morning. And certainly this is an unprecedented situation for all of us. And as I've described it here for our own staff for several weeks now, this is I would start off by saying that this is a very, very fluid situation. It used to be changing day by day. Now it's changing hour by hour, it would seem like. And so things that we thought were true days or weeks ago, or things that we didn't know days or weeks ago, have changed what our thinking and our planning and what we know about this particular virus and what particular what way we're able to manage with it. So let me start off by just giving you a little background on the coronavirus itself and how it came to be the COVID-19 disease. The coronaviruses are a large family of viruses, and they're sort of ubiquitous around us. In fact, they actually are the source for anywhere from 10 to 30% of common colds that we have in our own households. However, they're fairly unstable viruses, which means they can mutate. And when they mutate, it means that they can be transmitted from animal reservoirs to human reservoirs. And that's what we saw back in 2003, if folks are familiar with the SARS, the severe acute respiratory distress syndrome that broke out in 2003, which was a coronavirus syndrome epidemic. And then the MERS, the Middle Eastern respiratory syndrome that was transmitted in 2012. Now, this latest version, COVID-19, began probably in December in China, as everybody I'm sure on this webinar is aware, in Wuhan City. And it probably began in bats. We believe it was initially in bats. It somehow was mutated and transmitted into another intermediary animal. We don't know what it is right now. It was camels for MERS, and it was civet cats for SARS back in 2003. From whatever intermediate animal, it then mutated so that it could be transmitted to humans, which is where we are today, and in fact, today being in a pandemic situation. So with that mutation, how does that cause the disease that we're seeing today? So let me explain a little bit about the mechanics of it. Think of these viruses as having little hooks on them. And when you inhale droplets from somebody sneezing or coughing that are floating in the air, or if those droplets land on the surface of a desk, for example, and you touch that, and then touch your face, rub your eyes, get it around your nose, your mouth, it gets into your bloodstream, it gets to your lungs, and when it gets into your, when it is able to get to your lungs, little hooks on those viruses as catching onto maybe Teflon patches of your the cells of your lungs. And when that happens, it causes a response. The body starts to fight off this response, and that's what causes infection or fever. And that infection and inflammation causes a cough. And as this goes on, your lung cells trying to fight this off and converted by the various changes caused by the response, by the coupling of the virus to the lung tissue, cause the lung sacs to fill up with fluid, which makes it difficult for you to breathe and to get oxygen in. So that's where your symptoms come from. Now, the good news is that it appears in the months that we're familiar with this, that about 80% of patients that are infected with the coronavirus are either asymptomatic or have the symptoms of a cold or even a severe flu, and actually never get to the hospital, don't need to go to the hospital, and are just treated with symptomatic relief as you usually do with a cold or the flu. However, about 10 to 20% of these patients that are infected do get a severe illness and do end up in the hospital and can be very ill, and obviously there is mortality associated with that. So why don't I take a break here so we have time for more information and questions.
Thank you, Dr. Dobkin. I'd like to turn to Scott. Your organization, the Association of Public Health Laboratories, works closely with CDC and the World Health Organization, as well as many other national organizations. Could you share some of your perspective on that's a both local and global issue?
Certainly, thanks for having me here. So I want to start off on the global side, and as Dr. Dobkin said, the World Health Organization yesterday declared COVID-19 is a pandemic, and a pandemic is simply another term for epidemics that are happening in multiple places around the globe with a new disease and with sustained human-to-human transmission. So this isn't really new. This was expected. We've seen this over the course of the last month. So I think there's a lot of concern because of the term, but nothing has really changed between last night and this morning. The actions that we take as a community really don't change very much. There will be more drastic actions that happen over time, but it isn't simply because a pandemic was declared. I mean, we will talk about some of those actions with our colleagues in a little bit. But the situation globally as of yesterday, as of last night, Geneva time, there were 118,000 confirmed cases with 4,623 new cases reported yesterday and a total of 4,292 deaths with 280 new ones. So I think numbers can be very alarming, and I think we want to be able to focus on what the actions are that we can take for ourselves. So we are seeing spread across the globe, and what I call it initially is sort of a popcorn effect, where you're going to see cases popping up in different locations. We saw this initially with that first case in Seattle, and we now know where we are here. We're seeing it in different locations. So the public health system around the world is, of course, on, I can't even say high alert. I mean, they've been on alert for a month. There are issues around testing. You've seen that in the news. I think that even with even if the initial test that came out from CDC was perfect the first time, we wouldn't be far off from where we are right now. And at some point, as was discussed, the majority of the cases are, tend to be mild up to a severe flu, but not drastic where everyone has to be hospitalized. In fact, we don't want people who are ill showing up who are mildly ill showing up places where they can either spread what they have or get further infected. But to move to the United States, as of yesterday, CDC reported 938 confirmed and presumptive positive cases, and there were 29 COVID-19 deaths, and the vast majority of those illnesses, though, are in two places, are in Washington State and California. Both they are ramped up really, frankly, further than other places in the country because they've seen it sooner, and they had to deal with the repatriated flights from other places, the cruise ships, and other necessary measures that the federal government is taking along in conjunction with state and local government. So we do know that community spread is being detected, and you can expect that these case counts will go up. What we will talk about at some point during this is mechanisms and things that we can do to help flatten the curve. It's called flattening the epidemic curve. And those are the steps that individuals can take, institutions can take, and communities can take. So I think I will leave it there and turn it back to you.
Thank you, Scott. Now would like to turn to Dr. Qasba in terms of recommendations for local organizations and community leaders who are navigating this issue and obviously trying to make real-time decisions as the situation continues to evolve. So Dr. Qasba.
Thank you for allowing me to be here today and have a discussion. I'm going to briefly go over some high sort of yield thoughts so that we can leave it open for questions. I think people have probably their own questions, maybe relevant to their situation or particular questions. So two kind of words that I'd like for people to understand the definition, because these words are kind of very much used, is isolation and quarantine. So the definition of isolation is the separation of an ill person who has some sort of communicable disease from those who are well. So in general, if you have any outside of what we're dealing with today, if you are sick, in the past or in the future, it's important to sort of not expose yourself to someone who is well. So really to sort of contain the illness. The other word that seems to be used a lot is the word quarantine, and that people get very nervous about, but that's actually very much helps the epidemic in any time, and that's really separating and restricts the movement of well people so that they don't become exposed to somebody unknowingly, could be potentially asymptomatic, and that's how we have potential to spread the disease. So as human beings in general, I think some things that we have to remember, it's very easy for us to travel nowadays, get on planes, etc. So these are sort of things that we can use anywhere, whether we're here, we're on a plane, or elsewhere. Just remember to wash your hands thoroughly and wipe down areas. As people who travel on planes, an example, should be wiping down, their hand rests, their trays, as an example, and I know a lot of flights have been moving away to using disposable trays so that they don't have the risk of spreading any type of disease. Avoid touching your eyes, nose, and mouth with your unwashed hands. So really frequent hand washing is critical. Stay home when you're sick and encourage your family to do the same. That contains disease. And then avoid close contact with people that are sick. And particularly with coronavirus, the thought is that 6 feet sort of is your distance between people. And if you get any closer, there's a higher risk of acquiring the disease if exposed to someone. Cover your cough and sneezes with a tissue and then throw those away immediately. And then make sure you, like I mentioned earlier, to clean and disinfect frequently touched objects in your home in particular. And, if people come to your house, they may have had an illness, to make sure you wipe down very, commonly contacted areas. But just to reiterate what Dr. Dobkin said, this is a very fluid environment. Things are changing quite a bit. But as people, we can try our best to help control the disease spread with, minor things that we can do in life, but some things that we have to kind of take some thought to actually implement and do.
So let me just tack on
Sure.
to something that Sonia said about hand washing in particular. My wife and kids have all confirmed to me that there is no Purell to be found anywhere. So people are probably fairly nervous about it. But remember, soap and water is just as, if not more effective than hand sanitizer like Purell. So don't freak out if you don't have a whole caseload of Purell in your house. If you have soap and water, that'll be just fine.
So there are a couple of questions already out there, and people, if you want to put in questions, there's a Q&A box towards the bottom. So first of all, can you repeat the definition of quarantine and what that is versus isolation, just to make sure?
Sure. So quarantine is used to separate and restrict the movement of people who are well and who may not have been exposed to a disease, so that they don't become ill. So they're going to stay in their home. They know everyone in their home, as an example, are well. No one is sick. You kind of will stay in that environment and not be exposed or have anyone come to your home that may not be well. Isolation is separation of someone who's ill, so someone who's sick, so that they do not communicate this disease to someone who's well. So it's kind of actually quite difficult when it's challenging, when you live in a home and maybe one family member is working, has been exposed to somebody, so the idea will be to, you're already exposing your family members. It's very difficult not to expose them because you live with them. But the idea is, does it contain it in your home and not bring it out to the community or to your work environment, et cetera?
Okay, so a couple of further questions. So in what situations is it appropriate to close a school or preschool for what people are calling deep cleaning, clearly a technical term, as opposed to the regular increased cleaning that may be done on a regular basis?
So that's actually a really difficult question, I think, to answer. But I think, routine cleaning should be happening on a daily basis for any facility, in particular schools. I think deep cleanings they're moving towards that now, obviously, given that we have a spread of a infectious disease. How often that should be done is hard to say, but I think it's imperative, given our current state, that schools in particular, do go ahead and do deep cleans. And one comment I want to make, if it's okay, is that we're not seeing this sort of disease in kids, which is quite fascinating. But I wonder whether, and I'm a pediatrician as well, I wonder whether they're running around, they all have common colds, they always got runny noses, and that could be just an undiagnosed form of the disease. But this is definitely not a disease of the kids, which I think is good.
Sonia, I don't know if you agree with this or not, but I would think that with an abundance of caution, if a student in a school was a confirmed coronavirus patient, that would be a clear indication to do deep cleaning in a school. The next level up would be, what if a student in that school's family member is confirmed? Should that school undergo deep cleaning? I don't know. I don't know where the cutoff would be, to be quite honest. And I don't know that there's a gold standard. I think it's probably judgment.
I agree with you.
So I'd like to build on that. There are several questions having to do with when do we cancel or close, and let me frame it a little bit. There are a lot of people on this who run synagogues, and they have regular worship, and they bring together 300 people on a weekly basis. They have luncheons afterwards where people get together. What advice would you have in terms of, one, canceling or not those luncheons, those kind of communal meals afterwards? And what advice would you have about when do they think about canceling or limiting access to the worship services, particularly if you're talking about social distancing, and 6 feet may be hard to get when you're sitting in a sanctuary together?
So it's a difficult, I guess, question, and I think given where we are at this moment, and we know it's being spread, and we know people are asymptomatic, I think a lot of schools and a lot of meeting places, I know national, international, domestic, small meeting groups are choosing to cancel activities temporarily until we sort of see that we are not having an increased number of cases. I think that would be, I know it's difficult to do, but it's something I think places should consider, especially, in elderly population, as we saw at a facility in the Montgomery County area. I think you would have to consider at least temporarily canceling, not permanently, until we sort of see that the numbers are definitely decreasing or have leveled off.
I think we neglected to say, and I apologize in the beginning, that there are people that are at higher risk. I think everyone probably is aware of this, but just to reiterate, the elderly and patients and people with chronic diseases, particularly lung diseases, are at increased risk. So I think you could start, the first layer that I would recommend to the folks on this webinar would be to advise their congregants or their members that if they're elderly or have chronic diseases, they probably should not attend any kind of group setting in the short term until we learn a little bit more about this. Certainly anyone that has any symptoms of a respiratory infection should not attend any of these types of meetings. I would say that the size of the meeting would probably be, anything greater than 20 people would be of concern to me, even with social distancing. I would give strong consideration to canceling the lunch and learns that you may be having. Any other social events that may be occurring at the synagogues or JCCs in the area. As far as services go at the synagogue, that's maybe even a more difficult question to answer. Again, right off the top, I would say that, anyone that is having any kind of symptoms, even the mildest symptoms of respiratory infection, should really not attend synagogue services. I hate to punt, but I'd almost leave this to the rabbis to decide on whether they should have services or not on Saturday.
So this is Scott. I want to echo what all of your comments were. I agree with you. I think those numbers are good numbers, and I think just as some advice to rabbis, if you're in congregations where you are able to be creative and have the technology, and if you are the type of congregation that is willing to do things like distance services, I know some do, that's really important. I think it's also important that messages come from the clergy that it is okay to distance yourself. We have to also think of creative ways at this point to still maintain community. Because we are going to be distancing ourselves from, our friends, et cetera. And I do think the synagogues and congregations are very social places as well. So it's not just spiritual, it's social, it's emotional. There's a lot of things I think that communities can do together. And there's also, I think, opportunities for some creativity with this. And we have some really, really amazing institutions in our community to be able to do that. One other question that came up was about access to testing. And I did say that is limited, and that will increase over time. It's not going to happen overnight, and we know that, and I want you all to know that. But I'd like advice from our medical colleagues as to what are the recommendations if someone is ill. What I've been saying is please contact by phone your clinician and let them guide you in that way. Showing up and flooding the ERs is not going to help us as a community. That's not at all going to help us flatten the curve. But I'd love to hear from both of you.
So
Yeah. So this is a very hot topic, and
timely.
I think I think a couple key things that I think I would like to sort of speak about is that if you're well and you're concerned, I mean if you're well and you have mild symptoms, to really just stay at home. By all means, call your physicians and they can try and guide you. But the question is whether at the end of the day you should be tested or not. I think the situation in which we here, at least at Suburban, suggest people to come to the emergency room if they really can't manage their symptoms at home. So remember, at the end of the day, the symptoms are very common. I mean, very similar to the common cold, or for that matter, the flu. And generally speaking, we don't go to get tested for the flu, but in this situation, it's a little different because we're trying to understand the prevalence of this disease and trying to understand when it's going to be sort of controlled in a sense. So if you're well, I would recommend, if you're able to manage your symptoms, to stay at home, call your provider. There are some organizations that are doing telemedicine as well, to be able to speak to a physician on a phone or a computer. But if you feel that you're unable to manage these symptoms at home and you need to seek medical care, by all means, to come to an emergency room, and we'll do the best that we can with testing. But I'll defer to Dr. Dobkin for.
Well, I think that the point that is well taken is first call your primary care physician and talk to your healthcare provider first, rather than running to your local emergency department. We've been gearing up for this. I think all of the hospital emergency departments and hospitals in our region have been working and communicating together, preparing for this. But you can't totally prepare for it, and we are beginning to see the surge now tying up our emergency departments. with a lot of it being what we call the walking well that Sonia was just mentioning, the mildly ill that just want to get a confirmatory test or not, which is quite honestly clogging up the emergency department for really much more sick patients that need much more urgent care. So anything that can decrease the volume of patients coming to the ED because they're worried about whether or not they have coronavirus or not is beneficial. So speaking to your primary care physician first to get a better idea of whether there would be a benefit in being tested or not is the right first step to do.
So I'm going to ask some very specific questions, and we have a request from the people online, recognizing that sometimes giving advice, there's hesitancy in doing that because there's no perfect answer. But I'm actually going to put the three of you on the spot to a certain extent, more kind of what you would do. So, sorry. So, for example, there are a bunch of rabbis on the line who would love your advice. I mean, would you go personally to a religious service with 300 people in attendance where you can't have social distancing?
You're really putting us on the spot.
The only reason I'm doing this is there are people out there, they're trying to figure out what to tell. And I guess ranging down, I said 300, someone else said, what about a service of 20 people?
Right.
Kind of what would be the range? And to add one modifier is, like, you know, you already said people 70 and up or with compromised immunity definitely don't go. But what about someone who is 50 years old and healthy? Would you still suggest that they not go if it's a group of 20 or 300?
I think this is a very difficult question to answer. I don't think there's a right or wrong, but I think we have to remember to try and contain, this disease or illness. I think, going to some creative methods of I mean, you don't want to change your whole entire religious.
I'll just interrupt you and I'll just jump in.
Yeah.
At the same thing, and I'm going to be honest with you. I personally think I would not go.
I would say
I
the
would
same,
not go.
but,
Of that number? Yeah.
Yeah. So if it's a large 300s, I mean, just wanted to build on that. We had some questions about what if it's like less than 25? I know people throw around like different numbers.
Right.
Is it still not desirable?
So from my perspective, the 20 at this moment is okay in a large enough room that we know has been cleaned, right? 20.
Right. Yeah.
300, no way. But next week, we might say, maybe it's not worth it. So this is, I really appreciate you saying how fluid it is. We are learning day by day. This is a new disease. Coronaviruses aren't new. This is new. So we're learning from China. We're learning from South Korea. We're learning from Seattle. So I think, I really appreciate your honesty in this as well, in the sense that I think we all have to be prepared very quickly to pivot to much fewer gatherings.
So let me kind of build on that to continue just to push, because I know the gathering issue, I mean, there's like the mitigation and the cleaning and the gathering. So some questions about, there's some programs that are for seniors that are group programming. Would you cancel all those now because of obviously the risk to the senior population if any one of them brings it into that group?
I would.
Yeah, I would. I agree.
Okay. There was one other question that I want to go back to. It's about other at-risk populations. So we have group homes, and I'm scrolling back up on my thing here. So there's a Jewish Foundation for Group Homes, which supports adults with intellectual and developmental disabilities. And so is there any particular recommendations for a health vulnerable population? I mean, I don't know if in general, I mean, these are group homes. Do you propose that limit access to them, other ways that you can protect populations who may be living with each other but want to prevent disease from entering?
So I think limiting outside people coming in, because that's where you're going to have the exposure at the end of the day. If you, if there's no one sort of exposing the group home, I think that's sort of a way to consider at least temporary restrictions maybe on visitors would be something to consider.
Okay. There was a question about children as transmitters. So not as for themselves, because obviously it looks like for unknown reasons, whether they are able to deal with it or they're not getting it, but as transmitters to their grandparents, as transmitters to other populations. I'm sorry, we're putting out all the tough ones here. And, so, whether I have a 5-year-old at home, they're fine, but should I not be having Friday night dinner with, the grandparent because they can carry it even though they may never get it? What do we know about that, or what do we not know?
I think we don't know enough at this point, I think, to make any clear-cut sort of distinction. But I do think, as we know with children, it's very easy for them to put their hands all over things, and people, obviously. And, and a natural response to a child is to hug and kiss them, et cetera. But, I think in these situations, hand hygiene, washing hands, avoid putting on your, on each other's face. But I think it's a really hard question because we haven't seen a lot of this in children, and we just don't know enough to be able to, to say much about the transmission rate that may be occurring, because it could be, but we're not seeing, or for that matter, testing. And I don't think there's really any indication at this point to do any of that in testing. But Dr. Dobkin?
Yeah, no, we just don't know enough at this point to make any definitive answer. Personally, again, this is personally, I would not isolate grandparents from grandchildren.
So a lot of
would you hang out with your grandchildren, assuming you have some?
Yeah, I certainly would. Yes, I do, and I would hang out with them at this point. Yes.
I
mean to be presumptuous.
I'm assuming you would also wash their hand, have them wash their hands.
Yeah. Oh, that was going to be it. Washing hands would be. Although I will. On a personal note, I probably will not with my grandchildren, because my kids just got back this week from 2 weeks in France, which I'm pretty annoyed about. So I'm staying away from my kids and my grandchildren for the next week or two, but only because my parents were in France.
So part of this is looking at and just for the folks online, there are a lot of questions. I'm trying to go through them and pick ones that are larger and relevant to everyone. The general sense of the timeline for how far we need to be thinking about this, and particularly if we're thinking about canceling events, is this, people are looking most immediately, and I've been seeing events canceled through March. Should they just be looking at this as a few weeks at a time? Should this be looked at for the next month, 2 months, et cetera? What should be that time frame, recognizing that there can be future decisions about what happens in May, but kind of just for people's own kind of framing, how far should they be looking?
I don't know, Sonia. I know that I would be worried. I don't expect this to have any sort of plateau or resolution till like May.
I would agree.
Earliest.
I would agree. I guess I would definitely look at the month of, obviously we're almost the middle of, March and April. I would definitely consider, canceling events. I think once again, this whole concept of controlled environment, and that's what you're creating. Unfortunately, it isolates people through this process of canceling events, because socialism is very, to be able to socialize is important. But I would agree with Dr. Dobkin.
Okay. Hang on. Trying to. So there was a question about transmission on like objects,
Surfaces and fomites.
Surfaces and fomites, and how long. So people asked about what about mail that you get? What about other surfaces and whatever? What do we know about how long the virus can stay on these objects and be transmitted? You talked about kind of through moisture in the air, but what about surfaces and fomites, and how do we deal with that?
Yeah. So once again, I don't think we can definitively say any length of period or time. I just think you open your mail, wash your hands right after. It's really just keeping really making sure you keep your hands as clean as possible to avoid any transmission. I have not seen any data out there to say the length of period that the virus is viable, so to speak.
I mean, I've seen some stuff out there that it's viable up to 48 to 72 hours on the surface. But I don't know how valid that is. I think Dr. Qasba's recommendation of just remember to wash your hands whenever you touch something that's foreign, if you will. So,
Exactly.
You shouldn't not get your mail, or you should not open your mail out of fear of coronavirus. If everyone can be rational and thoughtful about it, we'll be okay. I mean, we know that people are going to. We know this is a virus. People are going to get sick from it. The vast majority will be fine, and it'll be nothing more than a cold and a hiccup. Unfortunately, some will become desperately ill with it, like any other communicable disease that's out there, including things like the measles or the mumps or chicken pox. So, we just have to be calm and rational about it.
So let me actually ask a question of my colleagues. So what about movie theaters and restaurants? So I just heard you say calm, and I am with you 100%. Life has to go on, and 80% tend to be more mild. So my thought is, the movies, you can get movies at home, right? You can go online and get movies. I don't want to slam the movie industry, but I think that's one thing. Restaurants, you can be at bigger tables. You can be further apart. I think we just have to be sort of rational about this. We're not going to close ourselves up in our homes for 2 months. That's not realistic. That's not America. No. So I wonder what your thoughts are about some of those kinds of things.
I think you're spot on. I don't think staying away from restaurants right now, not that I would be rushing to go to a particular restaurant, but I don't think that it's necessarily prohibited at this point. I would not go to a movie theater. I would not go to any, fortunately or not, the NBA has canceled their season already last night. I suspect a lot of the sporting events will follow suit. I don't know what's going to happen in the entertainment world, the theater, for example. I think that'll probably be the next shoe to drop. Again, I know I'm trying to be rational, and I may not sound rational, but I would question going to the theater personally. I don't have any scientific background or information to back this up. I just think in this current environment where we're saying, social distancing, I would not be going to large group endeavors. We just talked about, the issue of going to Shabbat services for example. The same thing would apply to going to, seeing Hamilton for that matter.
So one resource that I'm hoping most people have already seen is the CDC website on coronavirus. It's split up in a way that's very easy to navigate for anyone from the public, depending upon what you're looking for. There's also a very excellent section for the faith-based community. So if there's administrators that have not seen that, please do go see that. There's also posters that you can just print out from your computer to put everywhere, to remind people, because so much of what I heard today from our expert, from the medical care facilities is that this is about human behavior. And there's so much good information. Don't believe everything you see on the internet, but the CDC.gov website is excellent. The guidelines are changing. So it's important not to wait for the next webinar, but to look at it frequently. And I can't stress that enough, that there are people working very hard to be clear about this. So please do trust them.
The other part I wanted to add is that from Federation, we've worked to gather information from multiple sources, CDC, WHO, from the religious streams, others who are giving guidance out to whatever degree we can find it to the various institutions. So on our, one of the components from our homepage, shalomdc.org, we gather information and update it it's a daily basis. We don't update it more than a daily basis, but we are trying to provide and aggregate information from multiple sources that are, reliable sources, not just random things. And so if people want to do that, that'd be good. I want to ask, and I don't know if it's possible to answer this question because it really is a cost-benefit type thing. There've been questions about like bar and bat mitzvahs. It's one thing to tell people to join, online for a service if you can do that, and that's true. That doesn't work within the Orthodox community, but it could work elsewhere. Obviously, within Orthodox synagogues, they have to think about different issues and how to make this work. But someone is having their bat mitzvah in 2 weeks or in a month. A lot of cost has already been expended, probably not reimbursable, and obviously a big family gathering. I understand you may not be able to say to that particular person yes or no, though maybe you can. Any advice that could be given or things to do or not?
I would tell you that this is probably really a personal choice. I don't know how, quite honestly, I don't know really how to answer that. I understand, all the implications involved. It got to be an awfully terrible dilemma to be in. Personally, if I were in this situation, at the very least, I think I would sit down and have this discussion with my rabbi and help use his or her advice. Help guide that
they're offering the bar mitzvah rituals for the family, but having the congregants join remotely. So part of it is, are there ways of continuing, but in a different way? So that is one of the things, which also someone said, is the main event going to be canceled? I can answer it now. Yes, the main event is going to be canceled. That's for the people in the Jewish community. In terms of, like Hebrew schools,
Right.
particularly as public schools stay open, right? So, Montgomery County hasn't closed. I don't think anyone in DC or Virginia has closed the schools. Should synagogues be thinking about closing their Hebrew schools out of caution, or should they not? I guess someone just posted that Loudon is closed. I don't know if it's for long-term or just short-term, but.
I think for deep cleaning.
Yeah, so, yes, I think, some schools are closing. Some of the private schools in the area are going to be closing at the end of the week. I think, once again, it's hard to say, but, we don't want to limit so much of our social activities and change our life dramatically, but, perhaps temporarily, for maybe a week or two, deep clean the areas, and then kind of, restart the weekend. The school. That's. I don't know if you have anything else to add.
I'll go back to my original statement, I guess, on this, that if there are no confirmed patients attending the school, I would not close the school. If the local community public schools have closed, I don't think you have an option. I think you would have to close the Hebrew school. I think if I suspect that if I was the Hebrew school administrator and I learned that a family of a student had a confirmed coronavirus, I think I would probably close the school.
I would agree.
Scott, you want to?
Well, so I think the issue is going to be getting that confirmed, right?
Yeah, I'm talking about confirmed case.
Yeah, confirmed sickness by whomever. If a physician suspects it and says, go into, self-isolation, et cetera, or self-quarantine, whatever, that's one thing. I think that, and I heard this from a colleague this morning, where they said, my kid's going to go to school, but to me, at this point, the religious school is optional. And I said, what's the difference? Because the kids are in both places. And what they were worried about, frankly, was more of the older population mixing in with kids at the in the synagogue. And I said, I think that will end soon. I agree with you. I think it makes the most sense at this moment, to go with what the public schools are doing, but it is absolutely on the table. And we did just see that Loudoun County Public Schools are now closed March 12th through March 20th. So I think it is beginning, and I think being able to pivot quickly to closing is what is very likely to happen.
There were a couple of questions having to do with teachers or other professionals who may be connected if they are in an at-risk group. So if a teacher is, or someone, a professional, what if your rabbi is 75 years old? What are all these different possibilities? How do we, what do you say to that population? And so that's one question. I'm going to put up the other one, since there seems to be a bunch of responses to your previous answer, which is, if we're talking about canceling services, why would we not be talking about canceling schools? What's the difference between the two if we're trying to eliminate one kind of population coming together but not the other, or maybe they are more similar than not? So one about the at-risk kind of adults in this context and what do we do there? And the second one is about the difference between services versus schools.
I'll take the first one. Maybe a little bit easier. I think it really comes down to individual decision-making and individual choice. And, to a certain extent, if you're 75 years old, I think if you're 75 years old and you have risk factors that, you have heart disease, or more importantly, if you have lung disease or you have other chronic disease, I think this is the time to take yourself out of the social milieu, if you will, at least at this point in time. If you're a healthy, vigorous 75-year-old, I think that's your individual choice of how much you want to interact with others. As we've been speaking all along, we're trying not to foster a culture of complete isolation for everybody and solitariness. That's not healthy either. We recognize that, and that's where everything really needs to be somewhat of a balance. Would you agree, disagree, Sonia?
No, I agree. Some other, just kind of came to thought, as the weather's starting to get nicer out, one thing is to maybe take some of these activities outside where, you're not in a closed environment, right? And that's really what we are struggling with, because we have to keep a lot of activities. All the activities we're talking about so far are indoor. But, sometimes we can take some of the education outside, and I don't know, based on cultural beliefs, et cetera, but there are ways to, maybe move things as it gets warmer so that we still get the social, we get to see people and socialize, but at the same time in a sort of as safe of an environment given the current situation.
So let me push again on the one question about some of the Hebrew schools, 200, 300, 400 kids, 50 kids, whatever, who get together, and versus services. Would you cancel those as well?
I think you have to, sort of keep.
Well, I said there's a difference. It's hard to describe. I see the dilemma in some people's minds, but I do think there is a difference. A subtle difference, perhaps. One thing I would point out that the school are kids, and kids don't seem to be affected. We don't know whether they're not infected or they're subclinically and don't have symptoms. I don't know which one it is. But from that perspective, I think it's I wouldn't just cancel school off the top of at the top of my list without other things leading to that, like positive, confirmed positive students in the school, and I think that's different than, say, religious services. Certainly, they are larger volume, packed closer together in religious services than, say, smaller classrooms. Granted, there might be 400, 300 kids in the school, but they're not all in one classroom. I certainly would minimize, say, large auditorium type activities in the school. I probably would minimize those.
Yeah. So it's 12:31. I want to ask one last question and recognize people's time. There are a couple of questions about Passover. Kind of the most celebrated Jewish ritual, I think, that there actually is. What would you recommend? Family gatherings, people travel for it. I know this is a complete cost benefit. Who's there? What's going on? We cannot predict middle of April right now. Any guidance, whether it's family or communal seders. Sometimes some synagogues have a second seder together or something else. And we will, after that, we will end.
You end with a bang, I guess. I would tell you that for me personally, I intend to host, as usual, my family Seder. I don't know who will show up. I hope some people don't show up.
Your grandkids may be okay by then.
Yeah, that's right.
He was talking about grandkids.
But I don't know if I'll change. I don't know if I'll change my mind come 2 weeks, 3 weeks from now. I don't know. I'm conflicted. I don't know what to tell you about a communal Seder in a synagogue. I would be reluctant to advocate for it at this point. I think a family Seder within reason is probably okay. But again, this is March and that's April.
Right. So I'd like to thank all of you really for your participation and for your guidance and leadership on these issues. So Scott, thank you, Dr. Dobkin and Dr. Qasba, really appreciate this, and I hope that it was okay putting you on the spot. But I think people were really trying to understand what they should be doing in a very rapidly evolving and ambiguous situation where there are a lot of perspectives out there, a lot of different ideas, and where we're in this intermediate stage of it's about trade-offs and what can you do. And so just trying to get some framework for how we make decisions. So I really appreciate all of your time there and everyone for being on. We had about 100 people on this webinar collectively. And so looking forward to this. This was recorded. So we will, if it's okay, we'll probably post this as part of our website. We'll check.
This will have a short shelf life, as they said.
For the next 20 minutes, no. So thank you very much for being part of this.
Thank you for having us.
Thank you very much.
I hope we were helpful.
Thank you.
Thank you.
Thank you.
Thanks.
Bye.
Bye-bye.